Hi everyone, I am Dr. Sofica Bistriceanu. I am a family physician, PhD. I would like to thank you for this opportunity to share here some data from my clinical practice, data of interest for this discipline. The title of my presentation is Factors Implicated in Abnormal Cell Growth. Content of my presentation. Abstract, title, Factors Implicated in Abnormal Cell Growth. Then, people's interaction, general data, professionalism, general data, people's unprofessional behavior, general data, causes of the individual unprofessional behavior, effects of the individual unprofessional behavior on people's lives, evidence of the effects of an individual unwell behavior on cellular growth in vulnerable people, real case studies, including case reports, number 1. Highlights the excessive and inappropriate odds energy effects on human equilibrium. Case report number 2 highlights the impact of prolonged distress on cell growth in vulnerable individuals within a family setting. Case report number 3 highlights how prolonged and intense grief from the loss of loved ones may lead to changes in gene structure, potentially contributing to the development of tumors. Then, informative programs for the improvement of people's health, conclusion, and references. Abstract title, Factors Implicated in Abnormal Cell Growth. Background. Cell regulates their growth. Their control becomes more complex in a hierarchical model when arranged in various structures. Different internal and external factors continually modulate cell activity based on configuration, composition, timing, and force. Cells have limits for their self-control and are hierarchically organized with controllers. Cell shape, quantities, distribution, and function abnormalities may occur when thresholds are exceeded. The aim of this study to highlight the power of the negative thoughts and odds energy to alter cell growth in vulnerable areas of the human body. Material method. The author performed a retrospective observational study in the community from 1984 to 2024, referring to the risk factors for tumor appearance. Findings. One day in 1988, a 71-year-old woman experienced an excessive and contradictory discussion relating to obesity with a community member. 3 months later, she was diagnosed with a breast tumor. In 1990, a 33-year-old woman experienced prolonged disappointment in her married life. After 2 years, she was diagnosed with breast tumors. In 2018, a 83-year-old man suffered the consecutive loss of his wife and daughter 6 months apart. In 2020, he received a diagnosis of multiple myeloma and chondrosarcoma of the chest wall. Actions were taken. The interdisciplinary medical team manages the patient diagnosed with tumors. Results. This patient passed away after 10, 3, and 2 years, respectively. Conclusion. Inadvertence in communication, ongoing marital disillusionment, and persistent regretful feelings about loved ones passing away can affect the mental and emotional well-being of vulnerable individuals. People's intense distressing interactions and persistent negative thoughts seems to be implicated in the excessive cellular growth in fragile area. Discussion implications. People's illusion of independence please them, but they all depend on each other by exchanging goods or services. These interactions create various feelings that influence their inner life. Violent discussions can disrupt self-control, leading to cell abnormalities in fragile areas during growth. Additionally, the energy of intense negative thoughts may alter human equilibrium. It is essential to inform people about the powerful impact of their thoughts and words on their inner self. The comfort of communication improves well-being, and the peaceful internal life is essential for maintaining human balance and better health. People's interaction, general data. People's illusion of independence provide them joy, while in reality they all depend on each other to sell and buy goods and services, as no one can possess and know everything. They must interact in person or virtually to import-export their products and to attain a satisfactory personal, social, professional life for themselves and their loved ones. How they do that depicts their life trajectory. Professionalism, general data. Each individual selects a domain of activity according to their preferences, abilities, and financial capacity. Attaining expertise in the domain prepared for, quickly and efficiently handling data in practice, having skills in communication with others, proving sensitivity to needed people, and aligning with social norms ensure a successful existence. I put in figure number 1 the professionalist composite. Attaining expertise in the domain prepared for, quickly and efficiently handling data in practice, having skills in communication with others, proving sensitivity to needed people, and aligning with social norms. In healthcare, proving sensitivity to needed people, differentiate their work from other industries. Cool hard work hurts people suffering and diminish their wish to work collaboratively, finally affecting practice standing. People's unprofessional behavior, general data. Individual's behavior, definition. It refers to how one acts or conducts oneself, especially toward others. Or we can define in this way how a person responds to a particular situation or stimulus, or how a human body machine works or functions. Unprofessional behavior outlines the acts of someone who does not align with social norms and expected expertise in the domain prepared for. Usually, their response to a particular situation or stimulus hurts the people addressing it. Unprofessional people's interaction leads to various disorders in human function, such as sleep disturbance, dyslipidemia, obesity, type 2 diabetes, arterial hypertension, and even brain hemorrhage or tumors. Since individual suffering extends to their loved ones, improper communication is a significant problem for public health. Causes of the individual unprofessional behavior. Individual unprofessional behavior may be determined by genetics, medical conditions affecting perception, analysis, and actions toward various stimulus, uneducated people with impulsive reaction, burnout, or lack of work encouragement, that means disincentive work. The effects of the individual unprofessional behavior on people's lives. There are 3 categories. Effects of provider unprofessional behavior on personal lives. Effects of provider unprofessional behavior on customer, patient, and effects of provider unprofessional behavior on the customer's loved ones and the community. Effects of provider unprofessional behavior on personal lives. These effects are error in practice, medical errors, provider reputation decline, the determined return on investment decline, business stability declines, business growth and advancement declines, provider dissatisfaction with their professional or financial constraints, negative impact on the provider career, and all these elements determine provider distress. Effects of provider unprofessional behavior on the customer patient. These effects are poor clinical outcomes that determine patient adherence to the therapy plan declines, patient customer negative experience, patient dissatisfaction with the provider, patient loyalty toward the provider declines. These elements determine the return on investment decline. Effects of provider unprofessional behavior on customers, loved ones, and community. The effects are patient, family, and their loved ones' dissatisfaction with the provider, that determines selection of a new provider from the offerings for the next episode of care or business operation. These elements determine altered emotional life of the patient's loved ones, altered health of all parties implied in unfair relationships. These elements determine altered production process and have a negative impact on society advancement. Evidence on the effects of unprofessional animal behavior on cellular growth in vulnerable people. Real case studies. Case report number 1, number 2, number 3. As I mentioned in the content presentation. Case report number 1 highlights the excessive and inappropriate Earth energy effects on human equilibrium. Findings. One day in 1988, a 71-year-old woman experienced an excessive and contradictory discussion relating to a problem with a community member. 3 months later, she was diagnosed with a breast tumor. Patient medical history, arterial hypertension from 1962. Patient family medical history, parents, sisters, arterial hypertension. Actions were taken. The interdisciplinary medical team manages a patient diagnosed with a breast tumor. Results, clinical outcomes or improved under drug and surgical therapy. The patient passed away after 10 years. Conclusion. Excessive and inappropriate Earth energy disturbs human equilibrium in vulnerable individuals. It alters cell growth in fragile area. Attentiveness in verbal communication is required to prevent such events. Discussion implication. Each word has energy composed of speech characteristics and information transferred, meaning intense negative word energy may provoke gene instability, finally altering cell growth control. People must be informed about the potential alteration of cell control and function under unsafe people interaction energy. Excessive debates dangerously work on mental health, disturbing the nervous system control, and following various harmful effects on the human body function. Toxic, damaging communications must be stopped when necessary. Educational programs are required. Case report number 2 highlights the impact of prolonged distress on cell growth in vulnerable individuals within a family setting. Findings. In 1990, a 30-year-old woman experienced long-standing disappointment in her married life. After 2 years, she was diagnosed with breast tumors. Patient family medical history, parents, and a sister arterial hypertension. Actions were taken. The interdisciplinary medical team manages the patient diagnosed with breast tumors. Results: clinical outcomes improved under drug and surgical therapy. The patient passed away after 3 years. Conclusion: persistent, unsafe verbal and nonverbal communication between partners seems to be implicated in abnormal cell growth in fragile area in vulnerable individuals. Implication discussion. Attractiveness between partners may change over time in various circumstances, resulting in disheartening interactions. These illusions in conjugal life generate negative thoughts and persistent bad feelings, altering human equilibrium, especially in vulnerable persons, altering self-control in fragile areas. Informative programs relating to this topic are necessary for public health. Case report number 3 highlights how prolonged and intense grief from the loss of loved ones may lead to changes in gene structure, potentially contributing to the development of tumors. An e-poster presentation at Singapore Nursing Research Conference 2021, March 21-23, Magnus Group Conferences. The title of that e-poster presentation is the effects of loved ones lost on vulnerable people. Findings. In 2018, an 83-year-old man suffered the consecutive loss of his wife and daughter 6 months apart. In 2020, he received a diagnosis of multiple myeloma and chondrosarcoma of the chest wall. Patient medical history: duodenal ulcers, 1952, arterial hypertension from 1985. Patient family medical history: parents, sisters, and brothers, arterial hypertension. Actions or take. The interdisciplinary medical team manages a patient diagnosed with multiple myeloma and chondrosarcoma of the chest wall. Results: clinical outcomes improved under drug surgical therapy. The patient passed away in December 2020. Conclusion: prolonged and intense suffering from the passing away of loved ones alters human equilibrium and cell growth in fragile of vulnerable individuals. It seems to be implicated in the appearance of various tumors in vulnerable individuals. Discussion implications. Persistent, pessimistic thoughts determined by the absence of the loved ones passing away alter human body function. Prolonged bad emotional state energy may alter gene structure in vulnerable areas. It is possible that persistent, unsafe thoughts energy to foster deletion of parts of chromosome 13 or induct chromosome 14 abnormalities as observed in myeloma, finally appearing a proliferation of the plasma cell clone. Genomic instability can initiate further mutations and translocation. Bone tumors in evolution can lead to a spontaneously broken bone or a fracture facilitated by minor trauma. Mental life governance for individual functioning has to be considered in clinical practice. Informative programs for the improvement of people's health. Based on evidence from clinical practice, collaborative outcome among individuals can elicit a mix of feelings through their energy interaction. Effective communication enhances well-being, while poor information transmission can negatively impact people's health. Therefore, individuals must be informed about the influence of communication style on their health. They should choose their partners considering their ability to interact with collaborators and generate and handle data effectively in practice. Informative programs that address these topics are necessary. Conclusion. No one can live alone since they must continuously import, export goods or services as necessary. Their product exchange generates diverse feelings that influence human body function. People's intense, distressing interactions, ongoing marital disillusionment, and continuing regretful feelings from the passing away of loved ones can affect the mental and emotional well-being of vulnerable individuals. These factors seem to be implicated in tumor appearance. Socio-demographic factors predict individual surveillance. Selecting appropriate remedies for troubled time determined by stressful situations may prevent or attenuate the individual's malfunction. Ultimately, our mission is to facilitate the best solution to succeed over life's downs. Wrong consideration of things, events, and circumstances make us physically or mentally less vigorous, altering our health, while pondering existence maintains well-being. External life is connected with inner life. Taking time to think about our role, accomplishment, pitfalls, identifying our weaknesses and strengths, and working to overcome obstacles benefit us by offering a shining inside private and holy room. A peaceable internal life is essential for maintaining human balance and better health. At the end of this presentation, the audience will be able to recognize the value of communication style for their health, how excessive, aggressive, or energy can alter their health. Continuing disillusionment in marriage acts as a risk factor for cell abnormalities in fragile areas relating to the reproductive system. And the power of persistent negative thoughts energy to disturb cell control in fragile areas of vulnerable individuals. Thank you for your time and consideration. Here is a list of references. Thank you.